Dearest viewers, welcome to another fantastic episode where we talk about our health. And of course, I need to remind you that this is fully powered by Nature's Field. My name is Omobolanle Adigun, aka Omobolaval, and today we're going to be talking about something very interesting. And as always, we've got very interesting questions. Today we're talking about Myo-Inositol and PCOS. And of course, as usual, I have got two medical professionals who have got special interest in reproductive endocrinology. Welcome with me, Dr. Joanne and Dr. Richard. Hi.
Hi, it's so nice to be here again.
Hi, Brian.
Welcome on the show. Now, Dr. Richard and Dr. Joanne, just like I stated earlier, this episode, we're going to be talking about something very interesting. This is one topic that keeps coming up regularly in today's society, and I'm so excited that you both will be helping us answer a few questions from our viewers. So I'll just go straight into the first question. This one is from Amaka. She's 30 years old and she resides in Enugu. Her question is, I'm 30 and was diagnosed with PCOS 2 years ago. I don't ovulate regularly. Sometimes I go 3 or 4 months without a period. Can Myo-Inositol help with PCOS symptoms if you don't ovulate? And can it help restore periods after long stretches without a cycle? Also, does it help with insulin resistance in PCOS? Dr. Richard, please, I would love you to answer that.
Thank you so much, Belanli, for having me again. So, to Amaka, this is a very common situation, actually. Polycystic ovarian syndrome, what we are referring to as PCOS, is characterized by a number of symptoms. One of them is hyperandrogenism, which is an elevated level of the male sex hormone. We also have ovulatory dysfunction, which is made up of irregular ovulation or absent ovulation. Then there is also
the presence of cysts in the ovary.
Then there's also a presence of cysts on the ovaries, which is usually seen on ultrasound. Then in all of this, we also have insulin resistance. So insulin resistance, what it basically means is that the body is not responding to insulin as it usually should. So this is where Myo-Inositol comes in. So Myo-Inositol helps with insulin sensitivity. So insulin sensitivity, once that is addressed, you find out that in addition to other symptoms, it helps to work on ovulation. So usually this is not a magic bullet, as I like to say. It's not something that would offer an immediate relief. It's something that for a woman who has not seen her period in a few months, over a period of time, the cycle starts becoming regular. So say a period of about 3 months, we tend to see improvements. Yeah.
Wow, thank you so much, Dr. Richard. That was well delivered and, you explained in the simplest form. And I'm sure Amaka understands better now. Now, this one is from Kemi from Lagos. And her question is, I'm not overweight, but I have PCOS. Should I take Myo-Inositol if I'm not overweight? Also, can it reduce facial hair and acne from PCOS? Dr. Joanne.
Okay, so Amaka, right?
This is from Kemi.
Okay, Kemi, okay.
Yes.
So Kemi, PCOS is not just about weight. Even lean women can actually have PCOS. So PCOS is about the body being like not so sensitive to insulin. So like there's insulin resistance, and this makes the level of insulin in the blood rise, something we call hyperinsulinemia. So when there is this condition, it can directly affect the ovaries and stimulate androgen production. Androgen, I mean testosterone. So that's what is responsible for the clinical features that we see. That's the facial hair and the acne. So she said, what was the second question she asked?
She said she's not overweight, and
if
also
she can-
will they help for hair, like, and acne, from
okay.
PCOS?
So it's not, like I said before, it's not about being overweight. So once you have PCOS, you can use Myo-Inositol. Then about the acne, that's the acne and the facial hair. So over time, what Myo-Inositol does is that it improves the body's sensitivity to insulin. So when that happens, there is reduced insulin in the blood, there is reduced androgens that is responsible for the facial hair and for the acne. So over time, you're actually going to see some, changes, some improvements in the acne and the facial hair. It's just that we see like earlier improvements in acne than facial hair. So for the facial hair, you might need some additional treatments, like maybe hair removal, creams or laser treatments.
This one is from Zainab from Abuja, and she says, I ovulate sometimes, just not every month. Is it worth taking Myo-Inositol if I do ovulate occasionally but still struggle with PCOS? And what dose works best? Is the 40-1 ratio, Myo to D-Chiro ratio really necessary?
Okay, so what you're experiencing, what's her name again? Sorry.
Her name is Zainab from
Zainab.
Abuja.
Okay, so Zainab, what you're experiencing is actually what we call oligo-ovulation or anovulation. That is where sometimes you ovulate, sometimes you don't ovulate, and like for some people they don't even ovulate at all.
Wow.
But then for some people you're supposed to ovulate every month, but you're not ovulating as much. So it's something we commonly see in PCOS. So you can use Myo-Inositol, it would help you. And then for the dose, studies have shown that a dose of 2 to 4 grams daily in 2 divided doses is recommended. And what was the last question? I forgot it.
So,
okay, the 40-1 ratio. Okay, for that, actually, the 40-1 Myo-Inositol to D-Chiro ratio actually mimics the body's natural balance of Myo-Inositol and D-Chiro. So it's not even about marketing. That's the ratio that is used in PCOS studies.
Wow. I would want to direct this to Dr. Joanne still. It's a very short one. Do you need to take Myo-Inositol forever or just for a few months?
Okay, so it depends on what the goal is. So what are you trying to achieve? Are you trying to regulate your cycle? Are you trying to get pregnant? So it really depends. But what we recommend is 3 to 6 months. We recommend taking Myo-Inositol for 3 to 6 months. And then if you happen to get pregnant while you're taking it, you have to discuss with your doctor as to whether to continue or not.
Okay, thank you so much. Now, this is from Tolu from Port Harcourt. And the question is, does Myo-Inositol improve chances of conceiving naturally? And how long before ovulation improvements show up? My doctor said supplements won't make a difference. Is that true?
Okay, so this actually depends on the cause of infertility. So there's male factor infertility, female factor infertility. And then under female factor infertility, we have tubal factors, ovarian factors, we have uterine factors. So there's a list of factors. And then under the ovarian factors, we now have PCOS. PCOS is not even the only one. There are also other things that can be wrong with the ovary. But now we're talking about PCOS. If the cause of infertility is PCOS, Myo-Inositol would help to actually help like increase your chances or improve your chances of conceiving naturally. So that's to answer that question. Then the next one she asked.
Yes, she also said how long before ovulation improvements show up. And she said her doctor said supplements won't make a difference. Is this true?
Okay, so well, we have to be patient. We usually recommend 3 to 6 months, but we just have to be patient and see how your cycles change. And then your doctor is not wrong by saying well, I don't say he's not wrong. It actually depends on the cause of the infertility, like I said earlier. So you don't expect to take Myo-Inositol when you have blocked tubes because Myo-Inositol is for PCOS, helps with PCOS. So if the cause of the infertility is blocked tubes or maybe a male factor infertility, you don't really expect Myo-Inositol to help with that.
Thank you so much. That was quite explanatory. So this one is from Ifeoma. She stays in Lagos. She says, I started Myo-Inositol and now my cycle seems different. Is my cycle messed up because of it? Should I stop taking it if it seems to stop ovulation? Will it make ovulation earlier or later?
Okay, so while you're taking Myo-Inositol, there are going to be some hormonal changes. And this would actually cause some adjustments or some changes to your cycle. So it's not unusual to find that your cycle will change. It's a normal thing that happens. But when you should be worried is if maybe your symptoms worsen or you're having new symptoms. And what I mean is that, so normally in PCOS, because you're not ovulating every time, your period too doesn't come. So your cycle length is longer. A normal cycle length is usually between 21 to 35 days. But in PCOS, we see like cycle lengths as long as 40 days, 50 days. So you're on the medication. We expect that, the cycle length should be adjusting to normal, and you're still having cycle lengths as long as maybe 50 or 60 days. That means you're not even menstruating or ovulating in 2 months. You should be worried. And if after you use it for 3 to 6 months, you're not really noticing any changes, you should see your doctor.
Wow. Thank you so much for that. So let's move on to another arm of fertility, which is IVF. And I think at this point, I want Dr. Joanne to rest and I'll move on to Dr. Richard. I have a question that is IVF related, and this one is from Ada from Port Harcourt. This person says, can Myo-Inositol help with IVF success rates? What about in women without PCOS but doing IVF? Does Myo-Inositol make eggs more mature?
Finally, a question for Dr. Richard. Thank you. So, to Ada, right? Mm-hmm. Yeah, so we would look at it from the two aspects that you mentioned. So, in terms of people with PCOS and people without PCOS. So, for IVF, several studies have shown that Myo-Inositol helps with egg maturity and also helps to reduce the risk of ovarian hyperstimulation syndrome. So in a few other studies, it has also shown that it can help with increasing the rates of there being a live pregnancy, but that is still there's a lot left to be understood from that. So from the people without PCOS, the studies are not as clear as those with PCOS. So while a lot of IVF clinics still incorporate the use of Myo-Inositol into their normal procedure, it's not something that has shown a huge boost in success rate of IVF. And then it's also a worthy thing to note that Myo-Inositol, it's not going to it is not a bigger factor than age in terms of the quality of the eggs. Okay. So egg quality is still the major deciding factor in the quality of eggs. So it doesn't help with egg maturity.
Wow, thank you so much. That was really simple and straight to the point. Thank you so much. So this next question is from PC, who resides in Lagos. And she says, I have low AMH. Can Myo-Inositol help with low AMH or diminished ovarian reserve? How long before egg quality improves?
All right, BC. So AMH, the anti-Mullerian hormone, is a typical indicator of the ovarian reserve, as you rightly mentioned. It's a measure of how many eggs or how much eggs are remaining in the ovaries. So Myo-Inositol would not really help with that because it can't help to manufacture new eggs. It won't help in the production of new eggs. So, however, it can help in maturing of eggs, if we would put it that way, but it doesn't really have any effect on production of new eggs. Putting it that way, yes.
Wow, thank you for that. I mean, I just learned something interesting. Okay, my next question is, I'll be reading this one from someone else. Quite a number of people asked the same question. Can supplements like this replace fertility medications like Clomid or Letrozole? Dr. Joanne.
Yeah. So the short answer is no. Supplements would not replace ovulation induction agents like Clomid and Letrozole. What supplements do, especially Myo-Inositol, is to support specifically women with PCOS, helps with insulin sensitivity, helps to restore more regular ovulatory cycles. So it cannot be a substitute for Clomid or Letrozole because ovulation induction agents, they are well established medications that have been proven to show like very high efficacy in induction of ovulation, and it's actually the first line of management for anovulatory infertility.
Wow, thank you so much. That's so sound. So my last question will go to Dr. Richard. Now there's a balance. This one is from Chinedu. He resides in Abuja. His question is, my wife is taking Myo-Inositol. Can men take it for sperm quality?
All right, Chinedu, I understand the need for you to just want to take the same tablet with your wife and all of that. It will just make everything easier. So what I would say is that effects of Myo-Inositol in men is not really as understood as it is in women. It's not as widely studied as the effects in women. So some studies have shown that it can help with motility. That is how the sperm swims. Some have shown it can help with morphology. That's the general look of the sperm. Some have also talked about the mitochondria, that's the powerhouse of the cell, how fast it can swim and all of that. But the effects are not as widely understood as the effects in women. So I would just say that you should still see your specialist, and there would probably be some other medications, some other measures that would be put in place for that.
Okay, thank you so much. So before I let you both go, I know that earlier Dr. Richard talked about how AMH indicates like eggs and all of that. And you also mentioned that Myo-Inositol cannot produce new eggs. However, Dr. Joanne, I would love you to answer this question. Does Myo-Inositol boost the health of eggs in women without PCOS, or is it just anecdotal?
Okay, so the strongest evidence we actually have is in women with PCOS. Yeah, so in women without PCOS, the benefits are not as clear. Do you understand? So we usually recommend Myo-Inositol for women with PCOS. However, it's generally safe for most women. It's just not a miracle situation,
Yeah.
Wow. Thank you both so much for being so intelligent and for answering those questions in the simplest ways. So, dearest viewers, we've come to the end of this particular episode. However, this is what I want you to take home. In case you don't know the importance of Myo-Inositol, now you do. Myo-Inositol would help women with PCOS and also help women who are dealing with insulin resistance. So you know what to do. You should order your own Myo-Inositol product from Nature's Field. At this point, I would love to say thank you once again to my sound doctors for doing justice to our questions, and again to Nature's Field for organizing such a talk show that is quite educative and it's filled with a lot of information. And even myself as the host, I learn every day. Till I come your way again with my special guest next time. Thank you so much for watching. Stay safe and goodbye.